Thank you. I'm struck by your story, Shauna, and the choices that you have to make. You're facing $2,400 more per year in health insurance costs, correct? And when do you have to make this decision about what to do?
Well, we're still holding on to a little bit of optimism that everybody can come back to work and come together and help us.
Extend the tax
Yes.
care.
And that truly is the difference between that and my husband putting in his application to Costco in a few weeks.
So the decision has to be made right now. You can't make
Yes, we have just over a month.
You can't make it at some point in the future when Republicans get around to providing a health care plan of their own.
And we realize there is a lot to fix, and I truly hope you can all work together to do that. But we're talking about our premiums going up in just a short amount of time. And I know that these problems aren't going to get solved then. So please help us so that we can afford our premiums in 2026.
And the affordability question is here and now at your kitchen table in real time. When you go back to Wisconsin, and you face that decision, it's not maybe we'll reform the ACA and, to use the chairman's term, dismantle it and replace it with something else, something indeterminate and right now undefined. You have to make these choices right now. That's what Americans are doing, correct?
Yes, and we have that Costco application on our kitchen table.
And the alternative for you, and I'm quoting you, looking at your husband finding another job, considering shopping for a cheaper plan with a higher deductible, or going without insurance at all. I think I know the answer, but why is that scary?
Well, obviously with 2 children, going without insurance, we talked about it, but then we felt extremely guilty and realized that would not be a smart choice for our family. And we did shop, actually, and and as has been discussed by everybody, we weren't able to find anything a whole lot cheaper. So we are where we are right now, and I wish we could cut more out of our lives, but we've already been working on that. And again, it's not just those healthcare costs, it's our groceries, it's our gas, it's everything going up. So I know it's just over $200 a month, but that does make a really big difference for us, and we're hoping that we can save that.
This morning I met with a number of Americans from all around the country facing that same decision. I have transcripts of their remarks, including Aaron Lehman, the president of the Iowa Farmers Union. I'd like them entered into the record if there's no objection. Thank you. I want to come back to something that the chairman said to you before, and I'm quoting him directly, Chairman Johnson, quote, "That is Obamacare's faulty design. It forced individuals like you, individual policies, to bear the full cost of people with pre-existing conditions. Prior to Obamacare, we had something called high-risk pool. It worked great," end quote. Now, Shauna, when you explicitly asked what you would be expected to do if you were diagnosed with Huntington's disease, which is a deadly pre-existing condition, or the people like your mom who have it now, the Republican chairman said, and I quote him again, quote, "We would have done high-risk pools," end quote. These are highfalutin, fancy healthcare terms. So in simple terms, what it means is if you are sick, if you're disabled, if you're dying, the Republican plan is for you to pay more in the high-risk pools. You're grouped together with other sick people, and you all get to pay more. That's what they seem to want to do, which is rolling back. It is regressing to a very dark time in the history of healthcare in this country. I know it well because as Attorney General of the state of Connecticut, I went to bat for people who were denied coverage because they had these so-called pre-existing conditions. I don't want to go back to a time when sick people paid double for their health care, or they went without health care insurance and health care entirely. Can you talk about what that would mean for you or your family?
Yeah, absolutely. I actually, before the ACA, I remember having meetings with our state chapter social worker, the Huntington's Disease Society of America social worker, and discussed the pros and cons of testing and how to go about it. And we looked into options if I did have a positive test, and there was not a single affordable option. In fact, I'm not sure if there were any options for me for that. Like I said, luckily, I did not test positive for that. However, it's very important for me to know for the future of my children that no matter what comes their way, they will be able to have health coverage.
Now, the Trump administration is actually taking some action on health care. It has taken some unfortunate action, which is to increase the potential deductibles. It has issued new rules to increase deductibles. How would that kind of rule affect you? In other words, letting insurers charge higher deductibles as a solution to, quote, improper enrollments. What would it mean for your family if your deductible were to double next year?
That would be a big no, thank you. That is would absolutely not help. We do have things come up. We are a healthy family. We have sports injuries and things like that. So having a high deductible does not help the situation at all.
My time has expired.